portrait. Florence Nightingale, who was one of the first nurses ever, once said, the first requirement of a hospital is that it should do no harm. So what does do no harm mean? It can mean a variety of reasons for a variety of different people. It can mean financial harm, emotional harm, and physical harm. Most nurses go into this career thinking, I want to just help the patient. I want to help those in need. In reality, most nurses go home thinking, oh my gosh, I could have done better. I wish I would have had time to hold that dying patient's hand and ease their fear a little bit. Or the ultimate, which 90% of us go home feeling like, thank God my patients are not breathing at the end of my shift. Nobody died. Those are really hard words to hear. Well, it's even harder to feel as a nurse. So how do we get that? How do we change what society thinks of healthcare? Legislation must be set to not only help keep the patient safe, but to empower the nurses to ensure that they have a say in how to keep those patients safe. So the ultimate question, how do we get those patients safe? Safe staffing is a big step in that direction. Not just in healthcare, but for a variety of different ancillary jobs. The senior leadership, or those at the top levels, keep putting more and more jobs on the lower levels. You worked at a short staffing ratio yesterday, nothing happened, so why can't you do it today? Some institutions may say it's just cheaper to pay out if the hospital gets sued or for a sentinel event, either intentional or unintentional harm to those patients. Let's just pay those lawsuits. But if it was your family member, is a lawsuit worth that much money? Is a lawsuit worth it to you? According to the article Spread Too Thin, the federal mandated minimum nurse-to-patient ratio in the hospitals stated that the difference between working as a 1-to-4 ratio than 1-to-6 is 2.3 deaths per 1,000 patients. So think about it. If you work in a big hospital or a little hospital, if you have 3,000 patients per 6 months, that's almost 10 patients who have died due to short staffing ratios. Is that worth it from your loved one? Is it worth it to your mom or dad or child to be killed because of short staff ratios? The article, Nurse to Patient Ratios, the Sensitive Patient Outcomes, said with just one extra staff member, it's 14% less chance of a mortality rate. 14% less that your loved one will have a chance of dying. The nurses burnout. How much does it cost to orient a new nurse? Up to $15,000 for orienting a new nurse. Is that worth your patients, your loved ones' money? So then there's the ethical reasons. So if there is a legislative mandated law and you're not staffed appropriately, you send the patients away. You say, well, we can't take that patient, we don't have enough nurses. Have they ever asked the nurse how to fix this problem? I would say probably not, because I bet you the nurses will come up with a solution. Nurses' aides are a wealth of knowledge, are a wealth of help. So the hospitals do not get reimbursed well if they end up with a bed sore. The nurse's aide could actually change the patient. The patients with length of stay will increase. Right now, all it is about patient satisfaction. If you get an 8 on that survey, you're not going to get reimbursed. The hospital will get not reimbursed enough. How can the nurses help? We just want to do what's right for that patient. Ultimately, it's what society prioritizes. Improving nursing staff ratios is a budgetary concern. We all understand that. Patient interests, and ultimately decreased mortality rate. Is your mom, dad, child life worth that extra cost? and insurance companies? I say yes, it is. Have we become a balance sheet driven that finances dictate outcomes of the human touch? Do no harm. When will we say enough is enough? When are we worth that extra cost? Is your child worth it? Is your mom worth it? Is your dad worth it? The patients are worth it. We have to come up with a solution. Then you have to videotape everybody.
Oh, well, you do.
It's 5:22.
Oh, any questions?
Nope.
No?
Any questions?
I agree.
Very well
You
done.
agree?
I agree.
Very well done.
You guys don't want to see it.